Tonight, make sure you wear a mask when you can't socially distance, but are you doing it right? Here, we're going to talk about everything you need to know about how to wear your mask properly and houses of worship under COVID. All things aren't equal for churchgoers across the country. We'll find out more. So it's been 8 months now and we all know the drill. Wear a mask when you can't socially distance. But those are pretty broad guidelines, and the reality is that not all mask wearing is equal. Some practices are a lot more effective than others. So our guests tonight are going to help us understand some of best mask practices and some do's and don'ts. We have with us tonight Dr. Robert Rankins. He's an emergency medicine physician in Paris, Texas, and he also leads R&D for RCR Medical Products, which supplies first responders. Welcome.
Thank you. Thanks for having me.
And we have Sarah Baker. She's the programs director at Healthcare Ready, and she oversees their preparedness and resilience programming. Sarah, welcome.
Wonderful to be here. Thank you.
Excellent. So what I want to do tonight is get to some really practical information for people to understand. We all know we have to wear masks and socially distance, but I'm sure a lot of people aren't doing it right, and there's things they need to know. So maybe we can just start with mask materials and how often you should be changing them. Dr. Rankins, do you want to start with that?
Sure. I mean, as we all know, there's a lot of different masks out there, all the way from the N95s that we use in the emergency department to surgical masks, which are a little less effective than those. And then, of course, there's a lot of people out there that wear cloth masks, wear bandanas, wear gaiters, and all of those have a totally different effectiveness. The N95 is definitely the most effective. Unfortunately, they're not widely available yet. As far as, we have a little bit of difficulty keeping them in the ER, and the surgical masks are a little bit more broadly used. They're out there in greater numbers. And then, of course, the masks that you see, like you're showing now in a video, just the cloth mask that people make at home or that are made commercially that people wear. And then gaiters, of course, that people have used for a long time for, sports and different activities. The cloth mask, it really depends. I mean, there's one, if you're going to wear them, you need to wash them after each use, which is basically each day, which I don't know, how many people are actually doing that. The gaiters have actually been shown to be they're definitely not as effective, but maybe actually cause an increased spread of virus, which is, again, a study that has not been peer reviewed and needs to be looked at. But definitely that is one issue. And the other is that we've all seen people that wear the mask that either, they're wearing them under their nose, or they're continually kind of adjusting it up and then touching things. And so there's a lot of issues with that as well.
Okay, yeah, so I see a bunch of issues there. First of all, the gaiters, they're not so effective because people aren't washing them as often, or they're too thin, or they trap things. What's the problem with the gaiters?
They're both. The size, the opening in a typical gaiter is such a size that even respiratory particles, which we look at, say, the size of the virus, which is about 0.125 microns, which is a tiny, tiny thing. A gaiter, I mean, it's almost like trying to filter smoke with a tennis racket when you're wearing that. But fortunately, the COVID-19 and other viruses, they attach typically to respiratory droplets, which are much bigger. And so they do tend to, get trapped a little bit as they're going through something like that. But what has been shown in one study, and again has not been peer reviewed, is that the gaiter actually grabs the respiratory droplet, and then the viral particle continues on in travel, which then gives us an airborne particle, which is more dangerous than the respiratory one, because the respiratory droplets tend to fall out of the air quicker. So there is a little question on that. The other is that they do need to be washed frequently. And as you and I both have probably seen, that people that wear the gaiters, they have them on their neck and they'll pull them up, and then they'll pull them down and they'll pull them up. And so again, you're getting those particles on your hands if they exist, and then you're transmitting it that way.
Right. So no matter what mask you're wearing, if there's particle, it's going to be on the outside of the mask, right? So anytime you touch it, you're infecting
And
your hands.
correct. And most of the particles actually on all the masks, some of the studies have shown that the majority are on the outside because the mask serves the purpose of kind of slowing that transmission of that particle going out, but then they can tend to get trapped in that outer layer. And so that's probably actually has the highest viral load of the entire mask.
Wow. Okay. So based on that, Sarah, what are you recommending as practices that people? And I know there's a lot of issues too with not being a tight seal for most non-medical masks and that sort of thing.
Exactly. And I know one of the best practices that, we talk about, that public health officials talk about, is this idea of, not touching the front of your mask. And I think, a best practice to keep instilling is taking your mask off by the ear loops, by the pieces behind, which can be a hard habit to ingrain. And we see that, with the gaiters, that's, it's really not an option to be able to pull it off and remove it safely, because just as important as wearing a mask is removing it safely, removing it in an effective way. And so kind of, going back to this gaiters discussion, as the doctor said, they're usually much thinner. So if it's the only option available to you, if it's just, a bandana, something similar like that, layering has an impact. So if you can layer up, if you can put multiple layers on, that's something to keep in mind as well. So kind of, some of those best practices, being able to take it off by the ear loops from behind, really trying to get out of that habit of, popping it up even to just take a sip of water and then pulling it back down. If there's air coming in, it's not a great fit. You want to look to be changing it out.
I would say I see almost nobody taking on and off their masks that way. Like, especially if they're things are either eating or drinking or something.
Yep.
Yeah.
So how much of a difference will that make? Like if you tell someone, if you take it on and off properly, you're going to increase, your protection by X factor. What would you say to people? Obviously, it's not scientific, but general guideline. Dr. Rankins.
Yeah. No, that's fine. Well, I mean, it does decrease it absolutely if you use it properly. But unfortunately, even in the hospital, I see a large number of people that don't, don and doff the mask properly, because that is a difficult habit to get into, to reach back and grab the little things. And then you need to fold it to where the outside is now the inside, so that you're not touching that. And then when you pick it back up again, you got to pick it up by the loops and put it back on. And so, but to answer your question, I guess, would that help? Absolutely, I think it would. But this, again, how much education can you give people, and how many people would actually follow that? Because again, even in the hospitals, we see a large problem with people actually following those guidelines day in, day out, hour by hour. I mean, typically in the hospitals, you put a mask on, you leave it on for your entire shift, and you take it off at the end. And that then is effective unless you're reaching up and adjusting it or rubbing it. So, the only other thing would be that if you keep hand cleaner with you, which you should, and every time you touch that mask or you take it off, you clean your hands and you put it back on. I mean, that's the only other really good solution for that.
Okay, right. So the hand cleaning, which I was saying just before we started, I feel like that at the beginning, everything was about hand cleaning, washing your hands and sanitizing. Now I feel like that messaging has been a little bit lost, and it's more, just about the masks.
Yep. And I think that needs to really be reemphasized, because I think that and social distancing probably do more than the mask.
Okay.
I mean, I think those two combined you'd probably almost as effective.
And so what are you seeing in kind of social habits? Are people changing their social habits? We're talking a little bit about, handshaking and that kind of thing. Do you think people are sufficiently changing those dangerous social habits?
I think it varies. I know we were talking beforehand, how much of that is taking on in rural areas or urban areas. So I think we're starting to see some of those changes. I think what's important also in, this ongoing messaging, especially as we head into the holiday season and, winter where folks are going to be spending a lot more time inside, is, kind of to encourage good behaviors rather than, quote, punishing bad behaviors. So when folks are taking off their mask from the front, saying, not saying, hey, you're doing it wrong, maybe reframing to, hey, I heard you're supposed to do it like this from behind. So I think, that will also help us get to those good behaviors. We're seeing hand sanitizer in stores more and more. I think part of the push for that in the beginning, we saw that there was, shortages, or it became, price gouged and hard to get a hold of. So there was a lot of attention on it. I think we're starting to see that become more available now, and, just building that into, all right, I have my car keys, I have my wallet, I have my hand sanitizer, trying to build those into, your daily habits so you're not thinking about it. It becomes second nature.
I want to talk about kids. Most of the guidelines right now in schools and whatnot is under 2-year-olds, no need to mask, over 2, wear a mask, but that's still a pretty young age to, expect to have habit, proper hygiene habits. And, also discussion about psychological impact on little kids. What are your thoughts on that, Dr. Rankin?
Yeah, I actually think that masks with kids probably below the age of, I don't know, maybe even high school, may actually cause more harm than good because, like you said, I mean, smaller kids, I mean, you have trouble getting them to take a bath or wash their hands or anything else. And then when you give them a mask, there is, I don't think there's any way that I can envision anyway, and I've had kids, that you could train them to do the appropriate measures, taking that on and off. And so I think that you're actually probably may potentially be spreading more virus than you would without a mask. And the other thing with that is that most of the data out there now shows that kids under the age of, seniors in high school, 17, 18 years old, there's like a 99.996% recovery rate on this virus. So, I mean, it's not as big a concern. That's not to say that they can't carry it to someone else, but there has not been any documented cases of that. And so I do think masks in schools may be causing a little more problems than good, and especially for the educational purposes and things. So I don't know that that's the best idea in the younger age groups.
Sarah, do you have any thoughts on that one?
I think the doctor covered them pretty well. I think there's only so many ways we can make a game out of wearing a mask, or, trying to make it fun for kids, trying to, make it part of their fun routines and something cool that they can do with their friends. I think, Halloween was a great opportunity to build the mask into the costume, but, I think not too much to add beyond what Dr. Rankin had.
Okay. And Dr. Rankin, do you think this is going to be seasonal, or is this going to be with us a long time in season, or are we going to get rid of it? Because I'm wondering how long term, the constant mask wearing, the social distancing, we should be mentally preparing for.
Yeah, boy, that's tough because, it obviously didn't slow down much during the summer. We continue to see cases. Has it increased as the cooler months came on? Yes, absolutely. But it definitely didn't go away in the summer like we were kind of hoping it would. The other thing is that I have now seen patients that have had it 2 and 3 times in this 9-month period, and so that's concerning as well. But I do think it's going to be with us for a while, and I don't know, with the people getting it over and over. I even it's a little bit concerning for, are we going to get herd immunity, which is what we would like to have. And hopefully the vaccines that are coming out will do a better job than the virus itself, because again, we've had people getting it multiple times.
Oh wow, that's alarming to hear. How much time period was between their, coming down with it?
Well, I saw one patient in, I guess it was March, end of March, that had it, and then she tested negative in end of April, came back in at the end of June and had it, a much milder case, and then came back in again about probably a month ago and had a much more serious case. So these, the the ones that I know of, they've tested negative and then come back positive again. And so now the tests aren't 100%. So were they carriers and had a little bit back there that just didn't test positive and came back down with symptoms? That's still to be determined, but they're definitely getting it multiple times.
Wow, that's concerning to hear, to say the least.
Yeah.
And Sarah, what do you think about sort of the long-term trajectory of this? Can you imagine that we, are adopting these habits for the long term, for the long haul?
Sure. So, I don't want to worry of putting bounds on it or, a specific timeline, but did want to underscore, there has been a lot of great news about the Pfizer vaccine, about all these vaccines coming out. But even with that, it's important to keep in mind the vaccine rollout process is going to take at least a year as well. It's going to be phased first to healthcare workers and essential workers and those working critical infrastructure. So, while that was fantastic, encouraging news that the vaccines are, high efficiency or, looking to be high efficacy, I think it's some, kind of mentally steeling ourselves for, that we should be, preparing to wear a mask, at least I'd say, 6 to 12 months going forward, because as we roll out the vaccine, portions of the population will be vaccinated, but it's going to be a long-term effort.
So Dr. Rankins, we're going to have to wrap up here. So any final words of wisdom for us?
No, I mean, I would, I agree with everything kind of that's been said. I do think that the folks that are wearing masks, gaiters, whatever it might be, and kind of quote, doing your part and, and being safe, don't be fooled that gives you some type of protection to where you don't need to distance, you don't need to wash your hands. So be smart. I mean, the mask and those things, they help some, but they're not like once you put one on, man, I'm bulletproof and I don't need to worry about it. So the other things, to keep in mind, again, hand washing and distancing, and just be smart. And we'll all get through this. I think it's going to be there longer than we wish, but I think we'll all get through it.
Excellent. Well, thank you both so much for joining us tonight.
Yep. Thank you.
Thank you for having us.
Coming up after the break, church in the time of COVID. But first, here's America Q&A.
Masculine habits, I don't wear them.
I wear a disposable mask every day.
Usually I wear about 1 or 2 a day, depending on how much I'm out.
Single use, so I'd get rid of it after today. And then for reusable ones, probably twice, and then wash.
They discard disposable ones once a week?
I wash it, every couple days.
Daily on the cloth, and then throw away the paper ones if I use it.
I don't wear masks because I live in the country, so I don't wash it very often.
I typically use disposable masks, so honestly I usually change it out every day.
There are currently 2 cases before the Supreme Court related to restrictions being placed on houses of worship in New York State. One of them is from the Catholic Diocese of Brooklyn, and the other is by 2 Orthodox Jewish synagogues. Since the beginning of this pandemic, states have had different policies related to religious congregations. And here to explain some of those differences, legal issues involved, and their impact is Katherine Beck Johnson. She's a research fellow for legal and policy studies at the Family Research Council. Katherine, welcome, and thank you for joining us today.
Thank you so much for having me. It's great to be here.
Excellent. So, as I said in the intro, there's these 2 cases before the Supreme Court that's related to New York State. But could you start by giving us a sense of what the situation is across the country, maybe some of the extremes of the policies in different states?
So since the outbreak of coronavirus earlier this year, we've seen different states taking various approaches, restricting all sorts of activities. But one that's been particularly concerning is the restrictions on the ability to worship, to go to church, your religious liberty. And not simply that, the government is starting to curtail how many people can go to church, but specifically what's concerning is that churches are being treated differently than other retail stores, restaurants, those type of activities. And that's where it really becomes a constitutional problem. And so we're seeing this specifically from left-leaning states. And so that is what we're really tracking right now.
And so can you explain about the cases before the Supreme Court right now in New York?
Yeah, so Governor Cuomo reinstituted some restrictions, and with that, he said that churches could only allow 10 people, regardless of the size, whereas other retail shops, such as pet stores, there was zero restrictions on how many people could attend. So this is clearly the government treating churches differently. This is clearly the government disenfranchising churches and the synagogues as well, houses of worship. So they requested an emergency appeal to the Supreme Court, and we're currently waiting to see how that goes. We're hoping with the new appointment of Justice Amy Coney Barrett that this will be favorable to the synagogues and churches.
Have there been cases before the Supreme Court yet during the pandemic?
There have, specifically out of Nevada and California, but the Nevada case was what was most notable. There, the governor allowed the casinos to operate at 50% capacity and still only allowed a few people inside of churches, regardless of the size. And so that was very concerning. And actually, the Supreme Court, in a 5-4 opinion, sided with the governor of Nevada. Justice Roberts joined the liberal majority there in saying that it was up to the state. They were on the ground there. They were monitoring and tracking the situation, and therefore he deferred to the state of Nevada. Again, we're really expecting and hoping a different outcome now that Justice Barrett has replaced Justice Ginsburg.
So what are the arguments being made before the court in terms of why the churches shouldn't be under these restrictions?
They're saying that churches are more of spreaders, that in these stores people are coming in and out, but we know that churches really haven't been shown to be super spreaders. People wear masks, they're not taking them off at all, and they're simply not super spreaders. Whereas they think that because people are coming and going from a pet store, the virus isn't spreading as much. But regardless, if somebody's inside a church or inside a pet store, they should be treated similarly. If not, more deference given to the person at their house of worship, seeing as there's actually a constitutional right to worship, freely exercise your faith.
And I can't remember, was it New York or where there were cases where if the church facility was used for other purposes, not worship, then they were treated differently than an actual congregation worshiping. Is that the case?
California actually had a guidance saying that they had everything listed of what the church had to abide by, and then there was a specific note section and said if this house of worship is being used for childcare or is being used for a food bank, then they don't need to abide by these standards, and there's a separate set of standards for them to apply by. And then that depended based on what zone they were in. But you're very much correct that the actual guidance specifically noted if the building is not used for a church or worship service, then different guidelines apply.
Has that particular scenario been tested in court?
That has not, as far as I'm aware.
And so what's the case for churches? I guess churches, do they just want equal treatment, or they want to be considered essential services, or what's the argument on that side?
Well, so at a minimum, equal treatment, but there's this test that goes with the constitutional right of the free exercise of religion, and that's that the church really has to satisfy strict scrutiny, showing that they're using the least restrictive means to achieve their goal. And so the fact that they're allowing other businesses to operate shows that this really isn't the least restrictive means. So because there is a constitutional right to this, then they do need to satisfy the strict scrutiny test. So I would say at a minimum, they're requesting equal treatment, but really because there's a constitutional right here, they should be treated with even more deference.
So it's different across different states, and some states have deemed churches essential services and some haven't. So are there more states that have deemed them essential services and not, or has the breakdown look across the country?
No, less have deemed them essential, but as far as repealing restrictions, there were a lot of lawsuits in the beginning as the states were starting to crack down and treat them differently, and they were starting to win in court at the lower circuit level. So ever since they had started to be more successful in courts, a lot of the restrictions started to be repealed. I mean, even in Virginia, where I am, the governor issued a new order saying he was limiting gatherings to 25 people, but exempted religious gatherings. And Virginia has a Democratic governor. So you're definitely starting to see religion being treated more equally in a lot of the places. But as we can see, there's still Governor Cuomo, the governor of Nevada, that are not backing down and are still insisting. And so that's why we're having Supreme Court challenges.
I understand. And both of those cases are expected this week. Is that right? Rulings?
We're hoping. The reply brief was due today, so which should be coming in the next few days.
Okay. And how, from Family Research Council's point of view, how have churches been faring under COVID? I guess, they've had to do some things, at a distance, and, how are they doing financially? What's the status of churches right now?
The churches are being really resilient. They're adapting, they're finding ways to broadcast their services. It's unfortunate. There were, in the beginning, there was a survey saying out of 1,000 churches, over half of them were really suffering financially because there's not the collection. And so that's something, really to think about as well. These are there's real life impacts for these policies. Beyond just the right to be able to worship. And so seeing a decline in churches, we're hoping that there aren't long-term effects. Some churches are even having to close their doors potentially permanently, which is very, very disheartening. Beckett Fund for Religious Liberty just came out with